Well, at least 6 police officers have been killed in a bomb attack in northwestern Pakistan. Now, they've been assigned to protect workers carrying out a polio immunisation campaign. The attack was carried out near the border with Afghanistan in Mahmud. The Pakistani Taliban has claimed responsibility. Now, polio vaccination drives in Pakistan are regularly marred by violence. Pakistan and Afghanistan are the only countries in the world where polio remains endemic.
It's our responsibility to provide police security to every polio vaccination team, whether it consists of 2 people or 1. We send the security from here to far-flung places. Today, they targeted the police truck.
Zeeshan Salahuddin is the director of the Centre for Regional and Global Connectivity at the Tabadlab think tank. He joins us now live from the Pakistani capital, Islamabad. Good of you to join us on the programme, sir. The ongoing attacks on medical workers trying to immunise those against polio continue, but why?
Well, there's lots of reasons for that, Sahil. The principal reason among them is the fact that when polio campaigns do happen, a lot of these groups are vying for legitimacy. They want to demonstrate their strike capability. They want to showcase the fact that they have access to various parts of the country to be able to wreak havoc and conduct their violent operations. The polio teams are especially vulnerable because when the polio campaigns happen across Pakistan, and as you said, Pakistan and Afghanistan are the only 2 polio endemic countries left in the world, close to 300,000 people are deployed across the country to vaccinate millions of children all at the same time within about a 2 to 3 day window. Now, during that time, there are police officers and law enforcement officials that are assigned to these teams to protect them. But they are soft targets because to conduct a quick drive-by shooting in which you end up injuring and or killing the polio workers or police is a fairly easy thing to do. The second reason is what we're doing right now, Sohail. They know that polio is still a very important topic for news media outlets around the world. And if they conduct these kinds of attacks, channels like your esteemed channel, Jazeera itself, will interview people like me in order to ascertain the situation, determine what might be the root causes. And this, of course, will give them exposure and further establish their legitimacy. And the third, and perhaps a more dormant reason now, is the fact that since the killing of Osama bin Laden in 2011, which was conducted after a local doctor, Dr. Shakil Afridi, identified him having been embedded in a local NGO, there was a narrative spun by violent quarters within Pakistan that certain NGOs had been infiltrated by spy networks. And that narrative, the vestiges of it at the very least, we still see, particularly in Khyber Pakhtunkhwa and Balochistan, the 2 provinces that suffer from violence the most.
So who actually gains the most then, really, from these sorts of attacks? Because, as you say, there can be elements of desperate minority political armed groups that might benefit from this. But at the end of the day, you know, polio is a very visible ailment when it hits the human body, and any parent wouldn't want to see their child in that situation.
Absolutely. But you have to understand that the narrative that is spun is also created in areas that are very far-flung, very remote, where literacy rates are very low, and where penetration by groups like the Tehreek-e-Taliban Pakistan, that's the Pakistani Taliban, can be in certain areas quite high. The net result, of course, of all this is that people in these areas can be convinced of certain narratives that may or may not be directly at odds with their children's health. So, for example, one of the narratives that has been spun, particularly in the tribal belt, since June of 2014, has been the fact that in these areas, social infrastructure is limited, education is practically non-existent, the healthcare infrastructure and the legal frameworks do not extend to these areas. In every sense of the word, the social contract is not being fulfilled by the state. However, there's this very expensive vaccine that ends up showing up at their doors consistently every 3 months. And that leads to a certain rise in the level of suspicion, and that has been spun by these groups as grounds for rejecting these vaccines under the narrative that they will turn your children infertile. Now, anyone who's actually studying the growth rate in Pakistan will tell you that Pakistan's population has increased now to 241 million as of the digital census released in the middle of last year. But that doesn't really stop people from in remote areas to be indoctrinated by this very compelling narrative.
And what's left is an ailing health service protected by elements either of the police service or the military to get children vaccinated. What's really needed is strong government. The problem is Pakistan doesn't have strong government. The Senate has postponed elections that should have been destined for February the 8th. What it needs is a strong health minister and direction. And Pakistan hasn't really had that with the ups and downs of the political circus that's been going on these past few years.
Absolutely. The two existential problems for Pakistan that exist right now are its economy and its climate change. And despite that, there's a Gallup poll that was released yesterday that said that across most news organizations and political pundit shows in the evenings, 59% of coverage was actually given to political drama in the country. If you speak to any entities, whether they be inside Pakistan or outside of Pakistan, the one thing that they label as absolutely necessary for Pakistan to progress and for them to interact positively with Pakistan is political and policy continuity. So in that, you're absolutely right, in that we do need a direction from a strong health minister. But what I will say here, Sohail, is that the polio program, which is supported by UNICEF, WHO, funded in part by the Bill and Melinda Gates Foundation, and a range of other actors, including district hospitals, administrations, and provincial subjects, is actually a very comprehensive campaign. The real problem here is that the attacks that are conducted on the polio teams are very, very difficult to actually counter by security forces, simply because even if you were to double up or triple up the number of law enforcement officials that might be guarding these teams, to conduct and to cordon off an entire area and conduct a polio campaign in that area is still susceptible to a lone wolf attacker. And this is consistently what we have seen happen during the polio attacks across the country since as early as 2014.
Zeeshan, Salahuddin, it's been good to get your insight into the story, certainly for our international viewers. Thanks for joining us from Islamabad.
Thank you for having me.